All right, let's remind you again about some of those tips that you can embrace, particularly to protect you and your loved ones during this time of the COVID-19. Let's show you once again. All right, so the first thing is to avoid touching your face, as I was saying, particularly your mouth, your nose and your eyes, because if you've got these droplets on your hands and your fingers, this is a surefire way of spreading the virus to yourself. The next thing, wave rather than greet, shaking hands. So again, with social distancing, we're trying to make sure that you keep away from each other. So wave rather than greet each other with a handshake. Then, particularly when you're now in self-quarantine, the first step is stay at home. Only go out if you need medical care. That's very important. The first thing is to stay out of the public and stay at home. The second step is monitor your symptoms. Now, some of these symptoms are going to be things like fever, cough, shortness of breath. Those are some of the symptoms that will start to manifest if something is not okay with this virus. And that leads us to the third step. Once you've monitored those symptoms, you might start to become ill. And so the next thing for you to do is go and get medical attention as soon as possible, once these symptoms have taken hold and you're starting to feel ill. Your fourth step now is making sure that you know and follow all the steps about seeking care. So familiarize yourself, get to know what they are, and make sure that you know them like the back of your hand. Your fifth step, let's take a look at that. Don't go to work, don't go to school, don't go to any public areas. Avoid using public transport and taxis if you possibly can. And this is quite important. Again, the more you're out and exposed to the public, the higher the risk of spreading this virus to other people. So stay at home, don't go to work, don't go to school, don't go to public areas. And the sixth step talks about separating yourself from other people and animals, particularly when you're at home. So you're at home, you're self-quarantining, so try and separate yourself from other members of the family, and remember to keep surfaces clean, wipe clean the whole time if you can, and this is not possible for most of us. Please use a separate bathroom if you are self-quarantining. The seventh step is face masks should be used to help prevent the spread of disease to others. Cough or sneeze into the fold of your elbow, as we saw from the President a short while ago. Alternatively, cover your mouth and nose with a tissue when you cough or sneeze. And also make sure that once you've used this tissue, throw it away into a trash can, into a bin, and make sure that nobody retrieves it. So dispose of these tissues that you use straight away. Eighth step is clean your hands often with soap and water for at least 20 seconds. And some say that if you sing happy birthday twice, that should be enough. So literally, soap and water is good enough for every single person to protect themselves. You can also use alcohol-based hand sanitizers, but they have to contain at least 60% alcohol. So 60 to 90%, 95% alcohol if you're going to use a hand sanitizer. But otherwise, literally, soap and water is really good enough for every single person to protect themselves. And wash your hands at least 10 times a day. That will protect you. The ninth step of self-quarantine, again, avoid touching your eyes, your nose, your mouth, and unwashed hands. So once you haven't washed your hands for a while and you're exposed to surfaces, keep your hands away from your face, your eyes, and your nose. Wash your hands as quickly as you can after any kind of exposure to surfaces and people sneezing, that kind of thing. And then the 10th step is clean surfaces like counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, bedside tables. Pretty much any kind of surface that people are touching with their hands throughout the course of the day. Clean these and clean them again throughout the course of the day, just to make sure that they stay disinfected. All right, so now there's a lot of